If you're a patient dealing with a significant spine problem and you encounter one of the following three situations, this could mean that you may need spine surgery sooner rather than later. So let's talk about this. The first condition, which I think we should start by talking about, is a condition called cervical myelopathy. And this problem is surprisingly common. What is cervical myelopathy? Basically, cervical myelopathy is a condition where the spinal cord, usually in the neck, becomes severely compressed, either due to bone spurs, from arthritis and chronic degeneration, or from a large herniated disc which begins to squeeze the spinal cord. Now, obviously, the spinal cord is the connection between the brain and the rest of the body. So when the spinal cord gets compressed in the neck, what ends up happening is that it affects pretty much the entire body. So patients with spinal cord compression in the neck or cervical myelopathy begin to exhibit a lot of degenerative changes, which include weakness, numbness, tingling of the arms and the legs. And in severe cases, they can also have abnormal bowel and bladder function. Cervical myelopathy is a big problem. And the reason it's a big problem is because if you squeeze the cervical spinal cord for a long time, it begins to degenerate the cord itself, meaning the cells in the spinal cord called the neurons, they slowly begin to die. And there's really no way to reverse this process. So patients who have severe spinal cord compression actually develop a condition where they may not get better, even if they have surgery. So the key to a patient who has cervical myelopathy is for that patient to get this surgery rather quickly so that you can stop the progression of the cervical myelopathy. One of the most common surgeries that we do for cervical myelopathy is a surgery called anterior cervical discectomy and fusion, or ACDF. Sometimes the spinal cord is compressed at one level, so we do a one-level ACDF, sometimes 2, 3, or even 4 levels. And sometimes it is necessary to decompress the spinal cord through the back of the spine. So patients with cervical myelopathy should have surgery sooner rather than later, because once the degeneration of the spinal cord starts, unfortunately, there's really no way to reverse it. So you're better off having the surgery in the early stages of this condition instead of just waiting for a very long time. The second condition is something called a Cauda equina syndrome. This is actually much less common than cervical myelopathy. So what is Cauda equina syndrome? In very rare cases, some patients can develop a very severe compression of the nerves in the lower back, what we call the lumbar spine. And when you have a pinched nerve in the lower back, typically what you will get is sciatic symptoms, meaning shooting pain, numbness, or tingling going down the leg. But if the compression of the nerves in the lower back becomes extraordinarily severe and pretty much all of the nerves get pinched up, either due to a large herniated disc, which is the most common reason, or very slow progression of arthritis, which happens sometimes over a long period of time, sometimes it causes, in addition to the usual back pain and the sciatic nerve pain, it can actually cause a dysfunction of the bowel and bladder. So patients can sometimes become incontinent. This condition is called Cauda equina syndrome, and this is a surgical emergency. Sometimes this condition develops very slowly over a period of weeks, months, and other times it develops instantaneously because of a large herniated disc. So this is something that I've seen myself, that I've treated myself, and these patients will need a pretty much like an emergency surgery. If you wait too long to treat this condition, what ends up happening is that the dysfunction of the bowel and bladder, meaning the incontinence, can sometimes become permanent. And even with surgery, that cannot be reversed. So the initial signs of Cauda equina syndrome can be quite different amongst different patients, but typically this will involve unusual amount of sudden low back pain, a unusual amount of numbness in the groin and on the inside of the thighs, and accompanied by either urinary incontinence or bowel incontinence. So if these symptoms develop for patients, usually it's advisable for them to immediately seek medical attention because this is a surgical emergency. The third category of patients who should probably try to have surgery sooner rather than later are those who have been dealing with disabling pain for a long time, which results in disruption of their normal life. What do I mean by that? So I see some patients who have been dealing with herniated discs, pinched nerve, sciatica, spinal stenosis, And the treatment of this condition has pretty much taken over their whole life, to the point where they can't work, they have to take time off work, they have to change their jobs, they have to give up their hobbies. Whereas previously they used to walk a long distance, now they're walking a much shorter distance. They can't work in the garden, they can't play with their kids. So as time goes on, because of this intractable pain, basically their whole life gets turned upside down, and slowly they become disabled in a way. The problem is that if you let this condition go for a long time, if you let your spine problem fester for a long period of time, what ends up happening is that you become less active, you give up a lot of the activities that you enjoy, your quality of life diminishes substantially, you can't go on vacation, you can't do the things that you used to enjoy doing, and at the end of it, your whole body just weakens. So if you wait a very long time to have a surgery to treat these problems, well, by the time you end up having surgery, your body becomes very deconditioned. And I've seen patients myself who, after they recover from a spine surgery, they tell me, I wish I had done the surgery, 3, 5, or 7 or 10 years ago, because I suffered a lot in that time. And the other thing to consider is that if you wait a very long time before having a spine surgery, in that time, in that period, you become less active. You've lost a lot of muscle, something which we call sarcopenia. You've lost significant amount of bone mass, what we call osteopenia or osteoporosis. And a lot of patients will put on a lot of unhealthy weight, and their whole lifestyle will change. So as time goes on, these patients, not only are they becoming less active, they're also becoming less healthy. And if you end up having a surgery many, many years later, well, your body's not going to recover as well. And your recovery is going to be quite challenging, because recovery from a spine surgery at around age 60 is much easier compared to age 70 or 75 or 80. So if your spinal condition has brought the quality of your life to a point where you really can't enjoy it very much, I think those patients, instead of suffering, should talk to a surgeon and have a detailed discussion and find out if there is a surgical option to improve the quality of their life. And I think a detailed discussion with your surgeon will really be very meaningful to you as a patient, and I highly encourage that. So thank you for watching. Let me know what you think in the comments, and see you next time.